Thank you for visiting Dean Health Plan's online seminar. This on-demand session was created so viewers like you could watch and reference at any time in the convenience of your own home. Feel free to pause this video if need be to take notes at your leisure. In this online video, we are going to cover some key insurance terminology and the 4 different parts of Medicare. We will have an introduction to our Dean Advantage plans, go over who is eligible along with an explanation of plan benefits, prescription drug coverage, enrollment periods, and how to enroll. It's important to also understand some basic insurance terminology. Premium. This is the amount you pay to have insurance coverage. Deductible is an amount you pay before any other coverage levels start. Copay is a flat dollar amount that is your responsibility for a health service like a doctor's visit or prescription drug. Coinsurance is a percentage you pay towards a health service like lab tests. Cost sharing is a general term used to define any amount you pay out of pocket with insurance. Maximum out of pocket is an overall maximum you pay for all cost sharing combined in any category or situation. Let's start by understanding the A, B, C, and D's of Medicare. Medicare Part A is hospital insurance and helps pay for hospital stays, skilled nursing care, and home health care. Part B is medical insurance that helps cover doctor's visits and outpatient care. The Part B Medicare standard premium is set by CMS on an annual basis and paid by most original Medicare beneficiaries. Part A and Part B are also referred to as Original Medicare or Traditional Medicare. Part C is a Medicare Advantage plan that combines Original Medicare and usually includes Part D. Medicare Part D, otherwise known as prescription drug coverage, helps pay for outpatient prescription drugs that you would pick up at your local pharmacy. Part D also covers certain vaccines that aren't covered by Original Medicare. Now let's get into how Medicare Advantage works. Medicare Advantage plans are provided by private insurance companies such as Dean Health Plan. The insurance carrier contracts with Centers for Medicare and Medicaid Services, otherwise known as CMS. A Medicare Advantage plan replaces Original Medicare, providing you with all of your Medicare Parts A, Part B services, and Part D benefits all wrapped into one plan. Note that some Medicare Advantage plans do not have Part D coverage. A Medicare Advantage plan provides a maximum out-of-pocket cost for its members and may add additional benefits above and beyond. There are essentially 4 stages for Part D. We will try to break it down so that it's better for you to understand. Stage 1 is the deductible stage. You pay 100% of the cost of the drug until the deductible is met. Please note that certain tiers may not be subject to the deductible. Stage 2 is the initial coverage stage. We like to refer to this stage as the copay stage. In this stage, you will pay a copay or coinsurance for your prescription drugs, and the plan will pay the rest until the initial coverage limit is met. Stage 2 ends when you and the plan have together paid $4,020. Stage 3 is the coverage gap stage, or also known as the donut hole. In this stage, you pay 25% of your drug costs. Stage 3 ends when your total out-of-pocket costs reach $6,350. This is not including the amount that Dean Advantage has also paid. Stage 4 is the catastrophic coverage stage. In this stage, you will pay as little as 5% the rest of the year. For brand name drugs, you will pay $8.95 or 5%, whichever is greater, and $3.60 or 5%, whichever is greater on generic drugs. The stages start over each year on January 1st. The insurance company will send out an explanation of benefits on the prescription side to give you a heads up on where you are in each stage. Here is a quick guide to Part D to help you understand the different terms that are used when you use your prescription drug benefits. The formulary is a list of drugs that are covered by your plan. The formulary shows which medications are covered and what tier of coverage. Drug tiers. Each drug belongs to a tier, which determines how much you will pay for that drug. Usually, the higher the tier, the more you pay out of pocket. What is the difference between brand and generic drugs? Brand name drugs are drugs that are protected by a patent. the drug can only be made or sold by the company that holds the patent. Generic drugs are approved by the FDA as having the same active ingredients as a brand name drug, but generally, the generic drug will cost less. Network is the pharmacy options you have for getting your prescription drugs. Be sure to use a plan in-network pharmacy to get the best coverage for your prescription needs. Before making a final decision, you should make sure that your medications are covered under our plan. Our formulary is available online by going to deancare.com/Medicare, or you can also call one of our member services reps for help on looking up your medications. They are available again at 1-877-232-7566. Dean has an extensive pharmacy network that includes most major chains such as Walgreens, Walmart, and Hy-Vee, to name a few. We also offer mail order through Costco RX, where you can save time and money by getting a 90-day supply for only 2 copays on Tier 1 and 2 drugs. This option also includes free shipping. Let's take a look at the timeline to enroll into a Medicare Advantage plan. Here we have a calendar ranging from October to January. There are some key dates that you need to be ready for. Let's first talk about pre-enrollment. Pre-enrollment occurs October 1st through October 14th of each year. During this time, you can compare plans so you are ready to enroll by October 15th. Be sure to wait until October 15th to submit your application. Next, we have the Annual Enrollment Period, otherwise known as AEP. This runs October 15th through December 7th of each year. This is the time that you can enroll in plans or make changes to current Medicare benefits. Lastly, we have the Medicare Advantage Open Enrollment Period, also known as MAOEP. This occurs January 1st through March 31st of each year. During this time, you may switch from a Medicare Advantage plan to another Medicare Advantage plan, or terminate your Medicare Advantage plan and return back to original Medicare. To enroll in a Dean Medicare Advantage plan, you must have Medicare Parts A and B and continue to pay your Part B premium. You also must be a permanent resident of our Dean Advantage service area, which includes Columbia, Dane, Dodge, Fond du Lac, Greene, Iowa, Jefferson, Rock, and Sauk counties. And you can only be out of the servicing area for 6 months or less. Individuals with end-stage renal disease are not eligible to enroll in a Dean Advantage plan except under certain conditions according to federal law. For details, please contact Dean Health Plan or visit Medicare.gov. Dean Advantage provides both Parts A and Part B benefits as well as your Part D benefits all in one plan. You only have one plan to manage and fewer payments to track. Your Part A and Part B medical deductibles are covered. We eliminate your Medicare deductibles and provide a copay on most services. You have a maximum out-of-pocket limit that protects you from large catastrophic healthcare expenses. This is the most that you will have to pay for in a year for Medicare-covered services. Your prescription drugs are covered on all our plans and are covered with manageable copays according to our formulary, which we will touch on in a few minutes. You receive dental coverage on all our plans, with services that range from preventive to comprehensive care depending on the plan you choose. You will also receive 100% covered gym memberships through in-network health clubs through the Silver and Fit program. You have the opportunity to earn wellness rewards and incentives by tracking your healthy behaviors. You get great health care from doctors you know and trust. Dean Health Plan is part of an integrated health system where the insurance company, the hospitals, and the clinics work closely to build a better patient relationship. Dean Health Plan is very competitive when it comes to having a strong network of care. We have over 700 primary care providers, over 50 skilled nursing facilities, over 1,500 specialists, 19 hospitals, and much, much more. If you are unsure whether your provider is in our network, visit deancare.com/findadoctor or call our member services at 877-232-7566, TTY 711, 8 a.m. to 8 p.m. weekdays year-round, and weekends October 1st through March 31st. You have choices when it comes to your health insurance coverage. Here's a look at the different plans that we offer under Dean Advantage. Dean Advantage Essential HMO Plan, Dean Advantage Assurance HMO Plan, Dean Advantage Balance HMO Plan, Dean Advantage Confidence HMO POS Plan, and Dean Advantage Complete HMO. New for 2020, we have added virtual visits for certain conditions to all plans. We align the preventive dental benefits to be the same across all plans. We also added an eyeglass benefit on all the plans. Lastly, we will start covering the shingles and Tdap vaccine at a $0 copay until the catastrophic coverage stage. Just a brief recap on HMO and HMO POS plans. HMO plans are subject to a network, meaning you must use a plan provider in order for services to be covered. HMO POS plans have in and out of network benefits, so you have the freedom to see any doctor you would like to see, but would have better benefits using providers in network. Being on a Dean Medicare Advantage plan has a lot of benefits, including no waiting period for pre-existing conditions. Whether you have had cancer or a major surgery in the past, we will not hold that against you. Competitive rates that do not increase due to age. Our plans are not age-banded, meaning if you are 65 or 90, the premium is the same. No formal referral needed as long as you see a plan provider. Added benefits such as preventive dental coverage and covered gym memberships. Preventive services like your annual wellness visits, mammograms, colonoscopies, and some vaccines including the flu and pneumonia shot. When making a selection, it's always a good idea to consider that the plans are cost-effective for you, that your drugs are listed on the formulary, and that your primary care doctor, specialist, and hospital are available in our network before making a decision. Here is our benefit grid that gives you a snapshot of the plans. Feel free to pause the video to take some time to review. This is an overview of our supplemental benefits that Medicare doesn't cover that Dean Advantage plans cover as added benefits. In order to get these services covered, they must be performed by a plan provider. We will discuss these in more detail shortly. Now let's take a closer look at each of our Medicare Advantage plans coverage and added benefits. Let's start with our Essential Plan. Some key features of the Essential Plan are $0 monthly premium, a $20 copay for primary care office visits, $50 copay for a specialist office visit, $50 copay for urgent care, $80 copay for emergency room, $300 copay for outpatient surgery, $320 copay per day for days 1 through 5. This is per admit for unlimited number of days, and a $6,700 maximum out-of-pocket. Here are some of the supplemental benefits on the Essential Plan. $500 copay up to an annual maximum of $50,000 for worldwide emergent or urgent coverage. Please note that this is only for emergency and urgent care coverage while outside of the U.S. Earn up to $25 in Healthy Rewards yearly. You may earn points for completing healthy activities and taking self-assessments to gauge your personal wellness. Some examples of healthy activities is by entering that you had an annual dental visit, annual preventive screening, registering your Fitbit device, to name a few. Some self-assessment examples are by taking the Senior Health Cancer Prevention and Joint Pain Assessments. Gym membership is covered yearly when using a Network Silver and Fit gym. Some network gyms include Anytime Fitness, Prairie Athletic Club, Planet Fitness, and Curves. Please be aware that not all these gym locations may be in network. A $20 copay for acupuncture services, up to 12 routine visits yearly. Preventive dental includes 2 cleanings, 2 exams, 1 x-ray yearly with a $0 copay, and a $20 copay for chiropractic services up to 12 routine visits yearly. Deductible stage. RX deductible is $435. You will pay 100% of the cost of the drug until the deductible is met. The deductible applies to all tiers except for Tier 1. Tier 1 drugs are not subject to the deductible, and you pay a copay right away. The copay stage. Tier 1 has a $9 copay. Tier 2 has a $20 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. Tier 5 has 25% coinsurance. You will pay a copay until you and Dean together have paid $4,020. For example, If a Tier 2 drug costs $50, you will pay $20 and Dean would pay the remaining $30. But that total cost of the drug, the $50 for the cost of the drug, would go towards the $4,020 initial coverage limit. Coverage gap. You will pay 25% on generic and brand name drugs. You leave the coverage gap when your total out-of-pocket costs total $6,350. This amount includes the deductible, copays, and coinsurance that you have paid. Catastrophic coverage. You pay $3.60 or 5% whatever is greater on generic drugs, and $8.95 or 5% whatever is greater on brand drugs for the rest of the calendar year. Now let's take a look at the assurance plan. Some key features of the assurance plan are $40 monthly premium, $15 copay for primary care office visit, $40 copay for a specialist office visit, $40 copay for urgent care, $80 copay for emergency room, $250 copay for outpatient surgery, $260 copay per day for days 1 through 5 for inpatient hospital care. This is per admit for unlimited number of days, and a $6,000 maximum out-of-pocket. Some of the supplement benefits of the assurance plan include $500 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage. Earn up to $50 in healthy rewards yearly. Gym membership is covered yearly when using a Network Silver and Fit gym. $20 copay for acupuncture services up to 12 routine visits yearly. Preventive dental includes 2 cleanings, 2 exams, and 1 x-ray yearly with a $0 copay. $125 yearly allowance for eyeglasses. The eyeglass benefit includes eyeglasses, frames, lenses, or contact lenses from an in-network provider. $15 copay up to 12 routine visits annually for chiropractic services. Here is the prescription drug coverage under the assurance plan. A $350 prescription drug deductible that applies to Tiers 3 through 5. Tier 1 has a $6 copay. Tier 2 has a $14 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. And Tier 5 has 26% coinsurance. The initial coverage limit is until you and Dean have together paid $4,020. Coverage gap is from $4,020 through $6,350. Once you reach the catastrophic coverage, you pay as little as 5%. Some key features of the balance plan are an $82 monthly premium, $10 copay for primary care office visits, $40 copay for specialist office visits, $40 copay for urgent care, $80 copay for emergency room, $200 copay for outpatient surgery, $250 copay per day for days 1 through 5 for inpatient hospital care. This is per admit for unlimited number of days, and a $4,000 maximum out-of-pocket. Some supplement benefits of the balance plan include an $80 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage. Earn up to $100 in healthy rewards. Gym membership is covered yearly when using a Network Silver and Fit gym. $20 copay up to 12 routine visits annually for acupuncture services. Preventive dental includes 2 cleanings, 2 exams, and 1 x-ray yearly with a $0 copay. $175 yearly allowance for eyeglasses. $300 yearly allowance for hearing aids. $10 copay up to 24 routine visits yearly for chiropractic services. The prescription drug coverage under the balance plan has a $200 prescription drug deductible that applies to Tiers 3 through 5. Tier 1 has a $3 copay. Tier 2 has a $10 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. And Tier 5 has 29% coinsurance. The initial coverage limit is until you and Dean have together paid $4,020. Coverage gap is from $4,020 through $6,350. Once you reach the catastrophic coverage, you pay as little as 5%. Now let's take a look at the Confidence Plan. The Confidence Plan has a $185 monthly premium. Some key features of the Confidence in-network services are $0 copay for primary care office visit, $20 copay for a specialist office visit, $20 copay for urgent care, $80 copay for emergency room, 10% coinsurance for outpatient surgery, $120 copay per day for days 1 through 5 for inpatient hospital care. This is per admit for unlimited number of days, and a $2,000 maximum out-of-pocket. Some key features of the Confidence out-of-network services are a $30 copay for primary care office visit, $60 copay for a specialist office visit, $20 copay for urgent care, $80 copay for emergency room, 20% coinsurance for outpatient surgery, $500 copay per day for days 1 through 3 for inpatient hospital care, and a $10,000 maximum out-of-pocket. The maximum out-of-pockets do not commingle, meaning that the in-network max out-of-pocket does not go towards the out-of-network max out-of-pocket. Some supplement benefits of the Confidence Plan: earn up to $150 in healthy rewards. In-network plan details include gym membership is covered yearly when using a network Silver and Fit gym, a $10 copay up to 24 routine visits yearly for acupuncture services. Preventive dental includes 2 cleanings, 2 exams, and 1 x-ray yearly with a $0 copay. Comprehensive dental includes restorative services for fillings only with a 20% coinsurance, a $300 yearly allowance for eyeglasses, a $500 yearly allowance for hearing aids, a $10 copay up to 24 routine visits annually for chiropractic services. Some enhanced benefits of the Confidence out-of-network plan include an $80 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage, and a $30 copay up to 24 routine visits annually for chiropractic services. The prescription drug coverage under the Confidence Plan has a $0 prescription drug deductible that applies to all tiers. Tier 1 has a $3 copay, Tier 2 has an $8 copay, Tier 3 has a $47 copay, Tier 4 has a $100 copay, and Tier 5 has 33% coinsurance. The initial coverage limit is until you and Dean have together paid $4,020. Coverage gap is from $4,020 through $6,350. Once you reach the catastrophic coverage, you pay as little as 5%. Lastly, we have our Complete Plan. Some key features of the Complete Plan are a $241 monthly premium, $0 copay for a primary care office visit, a $0 copay for a specialist office visit, a $0 copay for urgent care, a $50 copay for emergency room, a $0 copay for outpatient surgery, a $0 copay for unlimited number of days, and $400 maximum out-of-pocket. Some supplement benefits of the Complete Plan include a $0 copay up to an annual maximum of $75,000 for worldwide emergent and urgent coverage. Travel benefit covers people for services as in-network anywhere in the U.S. except for in Wisconsin. This benefit is available for periods up to 90 days for a maximum of 6 months per year. You must notify member services in advance of your travel dates and state that you will be receiving care from non-plan providers. Note, the physicians have to accept Medicare assignment. Earn up to $200 in healthy rewards. Gym membership is covered yearly when using a network Silver and Fit gym. A $10 copay up to 24 routine visits yearly for acupuncture services. Preventive dental, $0 copay, 2 cleanings, 2 exams, and 1 x-ray yearly. Comprehensive dental, for all dental services, the plan pays 50 to 80% up to a maximum of $1,500 per year. Please note, this amount does not go towards your $400 medical max out-of-pocket. $300 yearly allowance towards eyeglasses, $800 hearing aid allowance every year, and a $0 copay up to 24 routine visits yearly for chiropractic services. Some prescription drug coverage under the Complete Plan include a $0 prescription drug deductible that applies to all tiers. Tier 1 has a $3 copay, Tier 2 has an $8 copay, Tier 3 has a $45 copay, Tier 4 has a $100 copay, and Tier 5 has 33% coinsurance. The initial coverage limit is until you and Dean have together paid $4,020. Coverage gap is from $4,020 through $6,350. Once you reach the catastrophic coverage, you pay as little as 5%. As a Dean Advantage member, you receive preventive screenings and other valuable services at no additional cost to you. Some services include annual wellness visit and annual physical exam. Medicare doesn't cover an annual physical. With our plans, we cover your annual wellness visit and annual physical exam. Virtual visits for eligible conditions. Some conditions include canker sores, minor burns, tick bites, sinus infections, and shingles, to name a few. To check other conditions, go to deancare.com/virtual visits. Dental exams, cleanings, and x-rays. Again, you can earn healthy rewards for completing healthy activities and taking self-assessments to gauge your personal wellness. And gym memberships or home fitness kits. Some popular at-home fitness kits are aquatic exercise, cardio strength, chair aerobics for everyone, and Tai Chi. Ways to enroll in Dean Advantage. The enrollment kit will provide all the necessary documentation to complete a Dean Advantage application. Apply anytime between October 15th through December 7th to have a January 1 effective date. Applications must be received in-house no later than December 7th. You may join or leave a plan only at certain times. Contact our Member Services Department or Medicare.gov for more details. To enroll, you can set up a face-to-face appointment. You may call our sales department to enroll telephonically, on deancare.com, or you can mail your application in by using the return envelope that is in your enrollment kit. Dean has a dedicated local sales support team to help you. Please contact us toll-free at 1-877-234-0126, TTY 711 with any questions. Walk-ins are also available by appointment only, Monday through Friday, 8 a.m. to 4 p.m. at 1277 Deming Way, Madison, Wisconsin, 53717. That will conclude our online seminar. Now's the time to understand what plan is right for you. We can help you understand what your out-of-pocket costs would be under the different Dean Medicare Advantage plans to find the best value and price for you. Make the most of your Medicare dollars and choose a plan that makes sense.